Thank you for staying tuned. Earlier, we brought you news about the medical practitioners' warning of the collapse of the healthcare system in Nigeria. We now have our guest who has reconnected with us, and that's Professor Dr. Philip Njemanze, Chairman of Chidion Medical Center in Owerri. Good afternoon once again. Glad to have you join me.
Good afternoon.
Okay,
and
fantastic.
welcome for having me. Thank you very much.
All right, let me start by asking what you think are the factors contributing to the collapse of the healthcare system in Nigeria.
Yeah, I wouldn't go too far as saying that the system has collapsed, but I think the system needs to be helped and actually beefed. We are facing several fronts. There is almost a mass migration of workers from Nigeria, healthcare workers from Nigeria to the Western countries, Europe and America. There is also a very low level of funding confronting healthcare practitioners and those who are in charge of hospitals in the private sector. And what we are talking about is 85% healthcare sector. That's the private arm. So it is, yes, it's a crisis, but though I wouldn't say it has collapsed because we are still very much functional. But the problem is that this lack of funding could be set up, could be well arranged. We have been talking about 15% of the budget being dedicated to health. That should be done. And then out of that, about 75% should be dedicated to private health care, because that's where the services. If the states do their 15% and federal do their 15%, and 75% of that is dedicated to private practitioners giving soft single-digit interest loan to provide amenity in the private arm. This will solve the problem. Nigerians have the best doctors, the best nurses in the world. And I know this for sure because I've been everywhere in the world. I've been to 46 countries.
If I may, Professor, you have...
so I'm quite sure about what I'm saying.
You have mentioned the myriad of challenges.
Doctors,
if I may, Professor,
in the healthcare sector.
Apologies for butting in there. Can you hear me?
What has failed?
Okay, I was asking, you've talked about a myriad of challenges bedeviling the healthcare system. I was going to ask you, what's the way forward? How can we begin to tackle some of these issues you have mentioned?
Yes, well, yeah, nothing works without money. The first thing to do is just that commitment, which is the world standard recommended by the WHO and all other organizations, that 15% of the budget should be dedicated to health. So when we look at that, just across the state, across the federal government doing their 15%, and the states doing their 15%, and since the private provides 75% of it, we are doing for the people what the government can't even do. So you provide that out of that 15%, 75% of those funds will go directly to providing single-digit interest loans to hospitals. So you can buy equipment, you can buy medication, you can upgrade the infrastructure with very low rates of interest rates. This will revolutionize health. I think this will become the healthcare in Nigeria, provided by Nigeria, will be the best in the world. I have never seen so much creativity among doctors, among nurses, among pharmacists, as I have seen in Nigeria across the world, and I've been everywhere in the world. So I really know how the system.
Now you've touched on the solution, which is funding, and the need for budget allocation to be much more when it comes to finance for the healthcare system. I want to touch on something else now regarding our medical professionals. We've seen lots of them, moving out of the country to better, environments they feel is more profitable. How can we solve that issue of having shortage of medical professionals in Nigeria?
Well, if you have a working place, just like you have a very pleasant working place, and you are paid salary on time, and you have job satisfaction where you work, migration is not an easy thing. I've lived abroad for 16 years, and it wasn't so easy living in a foreign country. So I must say that this trend can be very much reversed just by doing the right thing. Provide a healthcare bank and say, okay, the interest rate is fixed here at 5%, and let the doctors and the nurses and the pharmacists and all those who are involved, laboratory scientists who are involved in health, let them go and get loans, operate their hospital and pharmacies and lab with the modern equipment, and you will see what will happen. It will be a transformation the world has never seen, and I feel that our people can do. It just needs proper governance.
When it comes to attracting the right talents, you know, for health jobs in Nigeria to work as healthcare practitioners, how can they be attracted? And then beyond attracting them, how can they be retained to help improve the state of our healthcare in Nigeria?
Yeah, I think in today's economy, you see, we're arguing about minimum wage of 406,000. So I don't think you will find in any public system where you pay a doctor 1.5 million. Okay, and actually in most private sectors, you wouldn't find that, not to talk about public sector. So, and this is the type of salary we are talking about that we can afford to pay. If we could afford to pay someone that much money in our economy today, I don't think you will see people migrating out of this country. That's because they have other ties. They have parents, they have family obligations, they have all their life is here. So, and all these superimposed taxation. I can count 16 subheadings just in Imo State alone of taxes that hospitals have to pay, or under the local government, state. So you find out that these multiple taxation are very vexing problems in almost every state. This has been declared by the Federal High Court that the hospital is not a business. It is a public service in which people serve, because there is nothing you can do to equate a life. So it shouldn't be taxed the way it is taxed. Maybe the doctor will pay his personal income tax and also the nurse. But the truth of the matter is all these multiple taxations across the states and for the federal government should stop. It doesn't do anything. It just brings another vexing issue that the doctor might just think it's better to migrate out of this place.
And that's a fine place to wrap up. Thank you so much for your insight on the news. Professor Dr. Philip Njemanze, Chairman, Chidikon Medical Center in Owerri. Many thanks once again.
Thank you for having me.